writing of your NCLEX. We are just a DM away. So our main topic for today is cardiac dysrhythmias. Okay, so we'll be doing some cardiac dysrhythmias and basic interpretation of EKG for your NCLEX exam. Now, when we talk of cardiac dysrhythmia, before you even think of reading or interpreting any cardiac dysrhythmia, you should know this basic principle that in every EKG strip there should be a P wave, as you can see on the screen. A P wave, a QRS complex, and a T wave. So a P wave, which represents atrial depolarization, that is during an electrical activity when the atria contracts, and then a QRS complex also represents an electrical activity that causes the ventricles to contract. So for a sinus rhythm, it means that when you take an EKG strip, if you are seeing a sinus rhythm, it means you are seeing a P wave, you are seeing a T wave, you're also seeing a QRS complex, okay? Now, if you want to determine if it is a sinus rhythm or not, after seeing your P wave, your QRS complex, and your T wave, count the RR intervals. If you are counting your RR intervals and multiplying by 10, you should get a rate between 60 to 100. That is the normal heart rate for an average adult, 60 to 100. And then if you are counting your P wave as well and multiplying by a 10, you should also get a range between 60 to 100. And then the RR intervals, the P wave are all regular. That is how you can know that this is a sinus rhythm. Now, for you to talk about sinus tachycardia. So for sinus tachycardia, it means that we are seeing our P wave, our QRS complex, our rate is a little bit over 100. Okay, so from 100 to 150. That is a sinus tachycardia. Many factors can contribute to a sinus tachycardia. So in patients who are on certain medications, pain can cause a sinus tachycardia. Anxiety can also cause a sinus tachycardia. So patients who are dehydrated, any activity or anything that reduces our cardiac output, in hemorrhage, we can have tachycardia. Okay, so for our treatment, our main aim is to treat the underlying cause for a sinus tachycardia, whatever that is causing the sinus tachycardia at that moment. If it is dehydration, you hydrate your patient. If it is pain the patient is experiencing, you